How keep your heart healthy. Subscribe and ring the bell for more videos. The best way to look after your heart is with a healthy lifestyle. Be smoke-free. Being smoke-free is one of the best things you can do to protect your heart. Manage your blood cholesterol. Cholesterol is a fatty substance carried in your blood. Your body needs cholesterol to be healthy, but an imbalance of cholesterol in your blood can lead to a heart attack or stroke. Manage your blood pressure. Blood pressure isn't usually something you can feel. If it's too high, it needs to be treated. Manage diabetes. It's important to manage your diabetes to help prevent a heart attack or stroke. Be physically active. Regular, moderate physical activity is great for your heart health. It's never too late to start and get the benefits. It's also important to sit less during your day and break up your sitting time. Achieve and maintain a healthy weight. Maintaining a healthy weight can reduce the risk of heart disease and other health problems. It can help to know your body mass index and waist measurements and what these mean. Enjoy a variety of nutritious foods. Eating a varied diet of healthy foods can help with your weight, blood pressure and cholesterol. Look after your mental health. We know that there can be a greater risk of heart disease for people who have depression, are socially isolated or do not have good social support. Having a good social life with family and friends can help. Depression is more than feeling sad or low. If you feel depressed for more than 2 weeks, talk to your doctor, a family member or someone you know well. For more information about depression, the heart is a muscular organ in most animals, which pumps blood through the blood vessels of the circulatory system. Blood provides the body with oxygen and nutrients, as well as assisting in the removal of metabolic wastes. In humans, the heart is located between the lungs, in the middle compartment of the chest. In humans, other mammals, and birds, the heart is divided into 4 chambers: upper left and right atria and lower left and right ventricles. Commonly the right atrium and ventricle are referred together as the right heart and their left counterparts as the left heart. Fish, in contrast, have 2 chambers, an atrium and a ventricle, while reptiles have 3 chambers. In a healthy heart, blood flows one way through the heart due to heart valves, which prevent backflow. The heart is enclosed in a protective sac, the pericardium, which also contains a small amount of fluid. The wall of the heart is made up of 3 layers: epicardium, myocardium, and endocardium. The heart pumps blood with a rhythm determined by a group of pacemaking cells in the synovial node. These generate a current that causes contraction of the heart, traveling through the atrioventricular node and along the conduction system of the heart. The heart receives blood low in oxygen from the systemic circulation, which enters the right atrium from the superior and inferior vena cava and passes to the right ventricle. From here it is pumped into the pulmonary circulation, through the lungs where it receives oxygen and gives off carbon dioxide. Oxygenated blood then returns to the left atrium, passes through the left ventricle and is pumped out through the aorta to the systemic circulation minus where the oxygen is used and metabolized to carbon dioxide. The heart beats at a resting rate close to 72 beats per minute. Exercise temporarily increases the rate, but lowers resting heart rate in the long term, and is good for heart health. Cardiovascular diseases, CVD, are the most common cause of death globally as of 2008, accounting for 30% of deaths. Of these, more than 3/4 are a result of coronary artery disease and stroke. Risk factors include smoking, being overweight, little exercise, high cholesterol, high blood pressure, and poorly controlled diabetes, among others. Cardiovascular diseases frequently do not have symptoms or may cause chest pain or shortness of breath. Diagnosis of heart disease is often done by the taking of a medical history, listening to the heart sounds with a stethoscope, ECG, and ultrasound. Specialists who focus on diseases of the heart are called cardiologists, although many specialties of medicine may be involved in treatment. The human heart is situated in the middle mediastinum, at the level of thoracic vertebrae T5-T8. A double-membraned sac called the pericardium surrounds the heart and attaches to the mediastinum. The back surface of the heart lies near the vertebral column, and the front surface sits behind the sternum and rib cartilages. The upper part of the heart is the attachment point for several large blood vessels, the venae cavae, aorta and pulmonary trunk. The upper part of the heart is located at the level of the third costal cartilage. The lower tip of the heart, the apex, lies to the left of the sternum, 8 to 9 centimeters from the midsternal line, between the junction of the fourth and fifth ribs near their articulation with the costal cartilages. The largest part of the heart is usually slightly offset to the left side of the chest, though occasionally it may be offset to the right, and is felt to be on the left because the left heart is stronger and larger, since it pumps to all body parts. Because the heart is between the lungs, the left lung is smaller than the right lung and has a cardiac notch in its border to accommodate the heart. The heart is cone-shaped, with its base positioned upwards and tapering down to the apex. An adult heart has a mass of 250 to 350 grams, 9 to 12 ounces. The heart is often described as the size of a fist, 12 centimeters, 5 in length, 8 centimeters, 3.5 in wide, and 6 centimeters, 2.5 in thickness, although this description is disputed, as the heart is likely to be slightly larger. Well-trained athletes can have much larger hearts due to the effects of exercise on the heart muscle, similar to the response or skeletal muscle. The heart has 4 chambers, 2 upper atria, the receiving chambers, and 2 lower ventricles, the discharging chambers. The atria open into the ventricles via the atrioventricular valves, present in the atrioventricular septum. This distinction is visible also on the surface of the heart as the coronary sulcus. There is an ear-shaped structure in the upper right atrium called the right atrial appendage, or auricle, and another in the upper left atrium, the left atrial appendage. The right atrium and the right ventricle together are sometimes referred to as the right heart. Similarly, the left atrium and the left ventricle together are sometimes referred to as the left heart. The ventricles are separated from each other by the interventricular septum, visible on the surface of the heart as the anterior longitudinal sulcus and the posterior interventricular sulcus. The cardiac skeleton is made of dense connective tissue, and this gives structure to the heart. It forms the atrioventricular septum, which separates the atria from the ventricles, and the fibrous rings which serve as bases for the 4 heart valves. The cardiac skeleton also provides an important boundary in the heart's electrical conduction system, since collagen cannot conduct electricity. The interatrial septum separates the atria and the interventricular septum separates the ventricles. The interventricular septum is much thicker than the interatrial septum, since the ventricles need to generate greater pressure when they contract. The heart has 4 valves, which separate its chambers. 1 valve lies between each atrium and ventricle, and 1 valve rests at the exit of each ventricle. The valves between the atria and ventricles are called the atrioventricular valves. Between the right atrium and the right ventricle is the tricuspid valve. The tricuspid valve has 3 cusps, which connect to chordae tendineae, and 3 papillary muscles named the anterior, posterior, and septal muscles, after their relative positions. The mitral valve lies between the left atrium and left ventricle. It is also known as the bicuspid valve due to its having 2 cusps, an anterior and a posterior cusp. These cusps are also attached via chordae tendineae to 2 papillary muscles projecting from the ventricular wall. The papillary muscles extend from the walls of the heart to valves by cartilaginous connections called chordae tendineae. These muscles prevent the valves from falling too far back when they close. During the relaxation phase of the cardiac cycle, the papillary muscles are also relaxed and the tension on the chordae tendineae is slight. As the heart chambers contract, so do the papillary muscles. This creates tension on the chordae tendineae, helping to hold the cusps of the atrioventricular valves in place and preventing them from being blown back into the atria. 2 additional semilunar valves sit at the exit of each of the ventricles. The pulmonary valve is located at the base of the pulmonary artery. This has 3 cusps which are not attached to any papillary muscles. When the ventricle relaxes, blood flows back into the ventricle from the artery, and this flow of blood fills the pocket like a valve, pressing against the cusp switch close to seal the valve. The semilunar aortic valve is at the base of the aorta and also is not attached to papillary muscles. This too has 3 cusps which close with the pressure of the blood flowing back from the aorta. Right heart. The right heart consists of 2 chambers, the right atrium and the right ventricle, separated by a valve, the tricuspid valve. The right atrium receives blood almost continuously from the body's 2 major veins, the superior and inferior venae cavae. A small amount of blood from the coronary circulation also drains into the right atrium via the coronary sinus, which is immediately above and to the middle of the opening of the inferior vena cava. In the wall of the right atrium is an oval-shaped depression known as the fossa ovalis, which is a remnant of an opening in the fetal heart known as the foramen oval. Most of the internal surface of the right atrium is smooth. The depression of the fossa ovalis is medial, and the anterior surface has prominent ridges of pectinate muscles, which are also present in the right atrial appendage. The right atrium is connected to the right ventricle by the tricuspid valve. The walls of the right ventricle are lined with trabeculae carneae, ridges of cardiac muscle covered by endocardium. In addition to these muscular ridges, a band of cardiac muscle, also covered by endocardium, known as the moderator band, reinforces the thin walls of the right ventricle and plays a crucial role in cardiac conduction. It arises from the lower part of the interventricular septum and crosses the anterior space of the right ventricle to connect with the inferior papillary muscle. The right ventricle tapers into the pulmonary trunk, into which it ejects blood when contracting. The pulmonary trunk branches into the left and right pulmonary arteries that carry the blood to each lung. The pulmonary valve lies between the right heart and the pulmonary trunk. Left heart. The left heart has 2 chambers, the left atrium and the left ventricle, separated by the mitral valve. The left atrium receives oxygenated blood back from the lungs via one of the 4 pulmonary veins. The left atrium has an outpouching called the left atrial appendage. Like the right atrium, the left atrium is lined by pectinate muscles. The left atrium is connected to the left ventricle by the mitral valve. The left ventricle is much thicker as compared with the right, due to the greater force needed to pump blood to the entire body. Like the right ventricle, the left also has trabeculae carneae, but there is no moderator band. The left ventricle pumps blood to the body through the aortic valve and into the aorta. 2 small openings above the aortic valve carry blood to the heart itself. The left main coronary artery and the right coronary artery. The heart is the first functional organ to develop and starts to beat and pump blood at about 3 weeks into embryogenesis. This early start is crucial for subsequent embryonic and prenatal development. The heart derives from splenopleuroc mesenchyme in the neural plate, which forms the cardiogenic region. 2 endocardial tubes form here that fuse to form a primitive heart tube known as the tubular heart. 35. Between the 3rd and 4th week, the heart tube lengthens and begins to fold to form an S shape within the pericardium. This places the chambers and the major vessels into the correct alignment for the developed heart. Further development will include the septum and valves formation and remodeling of the heart chambers. By the end of the 5th week, the septa are complete and the heart valves are completed by the 9th week. Before the 5th week, there is an opening in the fetal heart known as the foramen oval. The foramen oval allowed blood in the fetal heart to pass directly from the right atrium to the left atrium, allowing some blood to bypass the lungs. Within seconds after birth, a flap of tissue known as the septum primum that previously acted as a valve closes the foramen oval and establishes the typical cardiac circulation pattern. A depression in the surface of the right atrium remains where the foramen oval was, called the fossa ovalis. The embryonic heart begins beating at around 22 days after conception, 5 weeks after the last normal menstrual period, LMP. It starts to beat at a rate near to the mother's, which is about 75 to 80 beats per minute, BPM. The embryonic heart rate then accelerates and reaches a peak rate of 165 to 185 bpm early in the early 7th week, early 9th week after the LMP. After 9 weeks, start of the fetal stage, it starts to decelerate, slowing to around 145 bpm at birth. There is no difference in female and male heart rates before birth. The heart functions as a pump in the circulatory system to provide a continuous flow of blood throughout the body. This circulation consists of the systemic circulation to and from the body and the pulmonary circulation to and from the lungs. Blood in the pulmonary circulation exchanges carbon dioxide for oxygen in the lungs through the process of respiration. The systemic circulation then transports oxygen to the body and returns carbon dioxide and relatively deoxygenated blood to the heart for transfer to the lungs. The right heart collects deoxygenated blood from two large veins, the superior and inferior venae cavae. Blood collects in the right and left atrium continuously. The superior vena cava drains blood from above the diaphragm and empties into the upper back part of the right atrium. The inferior vena cava drains the blood from below the diaphragm and empties into the back part of the atrium below the opening for the superior vena cava. Immediately above and to the middle of the opening of the inferior vena cava is the opening of the thin-walled coronary sinus. Additionally, the coronary sinus returns deoxygenated blood from the myocardium to the right atrium. The blood collects in the right atrium. When the right atrium contracts, the blood is pumped through the tricuspid valve into the right ventricle. As the right ventricle contracts, the tricuspid valve closes and the blood is pumped into the pulmonary trunk through the pulmonary valve. The pulmonary trunk divides into pulmonary arteries and progressively smaller arteries throughout the lungs, until it reaches capillaries. As these pass by alveoli, carbon dioxide is exchanged for oxygen. This happens through the passive process of diffusion. In the left heart, oxygenated blood is returned to the left atrium via the pulmonary veins. It is then pumped into the left ventricle through the mitral valve and into the aorta through the aortic valve for systemic circulation. The aorta is a large artery that branches into many smaller arteries, arterioles, and ultimately capillaries. In the capillaries, oxygen and nutrients from blood are supplied to body cells for metabolism, and exchanged for carbon dioxide and waste products. Capillary blood, now deoxygenated, travels into venules and veins that ultimately collect in the superior and inferior vena cavae, and into the right heart.